Hi everyone, my name is Gavneet. I'm one of the nurse practitioners here at Joy Wellness Partners, and we're going to be talking about a very important topic today. It's sexual wellness. And this isn't always the easiest topic to talk about, but it's a very important piece of our overall health. So, sexual wellness is not just cosmetic. Intimacy is a true vital sign because it can reflect vascular health, your nervous system, hormones, emotional safety, and tissue integrity as well. So it's a lot deeper than what most of us think about it or think of it. It's impacting how we feel in our own bodies, how we connect with our partners, and even how confident we feel day to day. And most people aren't taught how deep that connection is to circulation, hormones, stress, and just our overall health. And so at Joy Wellness Partners, we do take a holistic and regenerative approach where we're looking at the whole person when it comes to sexual wellness, because we know there are so many factors that are in play when we're looking at sexual wellness. So, we're going to talk about what actually drives sexual function. Like we chatted about, there's so many things that can influence sexual wellness. It's not just controlled by one organ or one hormone, it's a whole body conversation. And so, a big implication are cardiovascular diseases. When you have that restriction of blood flow and that restriction of oxygen nutrients to the sexual tissue, it's imperative, or we need that because it's imperative for erections, arousal, even lubrication and sensation to the sexual tissue. Same thing with metabolic issues. So, if there's any blood sugar dysregulation or, again, that reduction of blood flow from any metabolic issues, that's going to impact hormonal balance, energy, and vascular health to the tissue as well. Stress and anxiety. So we know that your nervous system is going to help control arousal and the ability to orgasm. So any chronic stress, anxiety, and trauma can not only blunt desire, but also sensitivity as well. And then medications. There's a variety of medications that can impact the desire, arousal, and performance. And so, just kind of backtracking a little bit, when you meet with one of us providers, we go through lifestyle, including the next topic, sleep, because we know poor sleep can disrupt nervous system and hormones. But we go through all of your medications, your past medical history, lifestyle, just so we can tie everything just so we can tie it all together when we're looking at the sexual health. And then, also hormones. So a big one is testosterone. And yes, even in women, that testosterone is going to be a big driver for libido and sensitivity as well, alongside that vaginal tissue. Estrogen plays a huge role in women because it's going to be supporting the vaginal tissue and lubrication. So we know that as estrogen levels are declining, we tend to have more of that vaginal dryness and vaginal tissue thinning, and less elasticity as well. Thyroid and cortisol, which is our stress hormone, also play huge impacts to this as well, alongside progesterone, which is that nice, like, calming hormone that can give us emotional safety. So, again, things that we also tie in when we're looking at the whole person when it comes to sexual wellness. And then brain chemistry. So, oxytocin, dopamine, and serotonin, those are all going to influence that bonding and confidence and pleasure that we have with our partners. And then also tissue health. So, there's a lot of things that are going to weaken our tissue over time or can just impact that vaginal tissue over time, aging, inflammation, hormonal shifts, and even childbirth. So, a lot of different drivers that can influence sexual wellness. And so that's where, when you're coming in, like I just said, you meet with one of us providers, we go through all of the different things that could be impacting this, because it's not just going to be one thing, one organ, one hormone. It's going to be a full body approach. Now, what actually happens to sexual tissue over time, right? Because it's not like it just happens suddenly. There are a lot of changes that happen to that tissue over years. That come from all of the things that we just chatted about, some of those factors. Blood flow does slowly decline. So, when you have less nitric oxide and less oxygen and nutrients getting to the tissue, that's where it can lead to weaker erections, less lubrication, and less sensation to the tissue as well. The tissue becomes thinner and less elastic. So, as estrogen levels are declining, as collagen production drops with age, that can lead to the vaginal dryness, laxity, reduced engorgement of the tissue, and even urinary leakage as well. And then sensitivity drops, as those nerve endings and nerve signalings are being influenced. So you have, less nerve communication and decreased sensation. And then there's also post-birth, childbirth changes as well. That pelvic floor has been stretched and it's been impacted. Nerve endings have been disrupted, and the blood supply has shifted as well. And these can show up even years down the road, especially when it comes to having like leakage and incontinence, or just some discomfort with intimacy as well. So what a lot of patients tend to tell us is that things just don't feel the same anymore. And what I like to remind them is there's true biology behind a lot of these changes. And so that's what we want to be addressing. We want to be looking at the whole person, and then also be looking at the tissue and tissue, nerve, circulation, all of that goes into the tissue, the sexual tissue. So here at Joy Wellness, we follow a regenerative model where we're looking at hormones and lifestyle, but we're also using things like platelet-rich plasma and shockwave therapy to help repair damaged tissue down at the cellular level, help with improving circulation patterns, and helping with nerve endings and sensation as well. And now, what does this actually look like? When we're talking about PRP or shockwave, what is it actually doing, and what does that even mean? So PRP is platelet-rich plasma. It's your own blood that we do a blood draw. We run it through our centrifuge, and that's where we pull the platelet-rich plasma from your own blood, and that is going to be full of growth factors. And basically, those growth factors signal to your body that, hey, regeneration and repair needs to happen to these tissues. So what it tends to do is, it's helping increase blood vessel formation. When we have new blood vessels that are forming, that allows for more blood to get there, better circulation, oxygen, and nutrients to actually get to those tissues. Nerve regeneration to help with the sensitivities and arousal response. Collagen remodeling, we just chatted about how that collagen loss can make the tissue thinner and decrease elasticity. And then reducing inflammation, just so we can help the entire environment of the sexual tissue. Now, with the PRP, where does this go? What does this look like? What can this actually help improve when we're talking about the vag, or when we're talking about the sexual tissue? So for our women, that looks like the O shot. And for our men, we're talking about the P shot when it comes to this regenerative medicine model. So for women, taking their own growth factors, their own platelet-rich plasma, and re-injecting back into the tissue can help with clitoral sensitivity, just overall vaginal tissue health and lubrication. So think about any like dry, thin tissue, arousal and orgasm quality, urinary incontinence, and just giving more comfort and pleasure during intimacy, because over time you can start experiencing some discomfort. And then for men, that's going to be the P shot, where we're increasing blood flow to the penile tissue, helping with circulation, helping with erection quality and firmness, sensitivity, and then tissue strength and girth, and then also just performance confidence as well. And what I like to tell people is, this is your own body's growth factors. It's not going to be any sort of fillers. It's not hormones. It's your own body using its own growth factors to help heal the tissue from within. And it can take a little bit of time to start noticing the results. Oh, there is a typo on these slides, but what it's supposed to say is weeks 1 through 3, that's when you're getting that circulatory improvement. Weeks 4 to 8 is when that nerve and tissue repair starts to accelerate. And then months 2 to 3 is when you actually notice the peak benefit from those. So, because we're using your body's natural growth factors, it's not going to happen immediately. We're using those growth factors to help heal your own tissue. And that's why, it's that gradual improvement over time. And then long-term wise, many patients will do this annually or combine it with other treatments like shockwave. Now, shockwave is acoustic sound waves. And basically, what those do is they stimulate new blood vessels growing, which is called angiogenesis, and boost nitric oxide signaling. So, what I like to say is it's that circulation accelerator. Um, when you combine them together, how I envision this is the PRP is helping restore the tissue itself. And then the shock wave is helping improve even more blood delivery to that tissue. So PRP is kind of helping, renovate the structure of the home, and shock wave is helping improve that plumbing. So that way we're able to get that, circulation all over that tissue that has been restored and regenerated. So the power of those two together, the PRP and the shockwave, helps to get faster response, faster recovery, better sensation, and longer lasting results as well. Some of our patients will do the PRP by itself. They may do the shockwave by itself, or they combine both of those modalities together, and that's going to be that, the heavy hitter there. Now, a typical shockwave protocol tends to consist of about 6 sessions. And sorry, this is another typo, about 6 sessions over 3 to 6 weeks. So typically about a session every week or twice a week if it's feasible. It's a non-invasive treatment, so it's quick and there's very minimal downtime afterwards. So it does make the 1 to 2 sessions a week pretty feasible for most people. About 6 sessions, and then maintenance sessions afterwards just to help with that durability of those results. Now, people have a lot of questions about this. They're thinking, okay, PRP, you're injecting plasma, my platelet-rich plasma back into the tissue, and the shock wave on top of that. So some common questions that we get asked are, does it hurt? So most patients can tolerate these treatments very well. The shockwave, like I said, it's a non-invasive treatment, so there's pretty minimal discomfort when it comes to that. The PRP is going to be the growth factors that are injected back into the tissue. Now, we do apply topical numbing, but then we also do a nerve block. So it's very similar to when you go to your dentist for any procedures. They do that first dental nerve block. That's similar to what we do. We do our initial injection that's going to block those nerves, and then the rest of it tends to be pretty comfortable. Minimal amounts of discomfort. I tend to hear some feelings of pressure, but overall very well tolerated. And then how long does it last? So typically about 12 months. It's going to vary person to person. The healthier you are, the more growth factors you have in that PRP. But most of our clients typically are getting treatments about once a year. And then when will I feel the results? Like we just chatted about, the most optimal effects are going to be about that 2 to 3 month mark, but you do start to notice improvements over those 2 to 3 weeks. And then, is it safe? So, it's not like fillers or anything else that we're adding into the tissue. It's your own blood. It's your own PRP that we're injecting back into the tissue. And then the shockwave is non-invasive and it has a very good safety profile. So very safe overall. And then, can I combine the treatments? Absolutely. It is actually encouraged. That's why we have specific packages to encourage patients to do the PRP with the shockwave, because it's going to give you the best outcomes. And there's other supportive therapies that we add in with that as well. So kind of touching on that, actually, we do add supportive therapies to this regenerative care because the PRP and shockwave are going to help that tissue locally. But things like the lab assessments, peptides, and supplements are going to help the whole system and help support that internal environment of your body as well. So hormone optimization can look like hormone replacement therapy, starting with the lab assessment. So, this is where we dive into your medical history. We're looking at a lot of different labs, not just your sex hormones themselves, but also looking at your thyroid hormones, looking at vitamin levels, looking to see if there's any sort of insulin resistance. So all of those things we know can impact sexual function. And so doing that thorough analysis and coming up with a plan. And then peptides. So peptides are basically like biological messengers. There's a variety of different peptides, and you chat with us and we figure out what's going to be the best bet for you. But some of those we use to help support the desire signaling. Some can be used to calm the nervous system, and then others to improve that emotional connection, because you know that you want that bond and sense of safety within your body in order to even have desire towards sexual function. And then we integrate supplements. Examples of those are like Vasconox or Tyrosol, but then also other supplements based off of the lab assessment that we do. Are Vasconox and Tyrosol specifically, those are going to be for the endothelial health, improving nitric oxide production, and then just helping with overall long-term circulation, not of just, the sexual tissue, but just overall circulation in the entire body, which we know that you need. And so, we utilize the PRP and shockwave to do the rebuilding, and then we use these supportive therapies to help hold on to the results. And we have a variety of different package options that, are PRP by itself, shockwave by itself, or the packages. And it's actually, I think this next slide will go through some of these packages here. We have different male and female bundles. These can look very overwhelming. And so my recommendation for everybody is to always come in and meet with one of us providers. We'll be able to dive in a little bit as to what your struggles are and really help hone in onto which bundle makes the most sense for you, because it's not cookie cutter and not everyone's going to be the same. But these are just some of the bundles that we have. And for this month in February, you do get $300 off all of our sexual health bundles, which is really exciting. Or you can do buy one, get one for the O shot or P shot. So bring in your partner or your friend and help support that vaginal tissue. And then we can always chat more about some of the other supportive therapies that can go into supporting the sexual tissue as well. Now, we've talked a lot about, restoring that blood flow, helping with that tissue health and desire, but none of these things work if your cells are exhausted. And so, this whole Lunch and Learn is talking about love, libido, and longevity. And it's hard to have a conversation about longevity if we don't talk about NAD. So NAD is a molecule that your body naturally makes. It lives inside all of our cells, and it plays a huge role in cellular energy, brain function, and just overall recovery. So energy, clarity, resilience. Your body uses NAD to make to power cellular ATP production, which is basically using NAD to make energy for your body to utilize. It's going to be important for metabolic support and just, overall anything that you can think of that requires cellular energy, NAD is going to be important for. And it does start to decrease, with age. NAD levels do decline. And other things like aging, poor sleep, chronic stress, heavy training. I didn't even realize that they were literally on the slide, but inflammation, metabolic dysfunction, all of these things can just help accelerate that NAD decline. And so it's really important to make sure that we're restoring those NAD levels, because we know NAD is going to be, important for energy production, mental clarity, healthy aging. And so what happens when NAD levels start to drop is patients will notice fatigue, slower recovery from their workouts. Brain fog is a huge one that I hear a lot. And just the feelings of feeling depleted or just feeling kind of flat in their mood, and low motivation. And so, with those optimal NAD levels, you can expect to have like more steady energy, clear thinking, improved mood, recovery feels better. You have a little bit better stress tolerance. And usually this is like a fun time to talk about NAD, because by mid-February, we're kind of in that like winter funk a little bit. We have less sunlight during this time, maybe higher stress. In some parts of the states, we have lower activity levels because of the weather. And so this is a great time to bring in NAD just to help restore those levels, to give you a little bit more of that energy, clarity. And the NAD protocols, they're different for everybody. Again, it's always coming in, meeting with one of us to figure out what, sort of NAD protocol you should go on. But most often it looks like those NAD IVs. And actually, in the month of February, those are also buy one, get one half off. So that's really exciting. But when it ties into this whole conversation, the important connection here is if your body's exhausted at the cellular level, then libido also drops, right? Because your body's going to prioritize survival over pleasure. And so while NAD isn't like a sexual treatment, it supports the foundation of everything, it supports the foundation that allows everything else to work that we just talked about. So think of NAD as like a way to help recharge your cellular battery so that your body can respond better to that regenerative care, like the PRP and shockwave. So, just another modality that we talk about. Intimacy isn't a luxury, it's a part of being a human. And I think everybody deserves to feel good in their body. And that comes from a very big multifactorial approach. Love is like connection, libido is vitality, and it's a vital sign for your body and, overall health. And then longevity is cellular health. So you kind of have to combine all of those things together when we're talking about sexual wellness. But yeah, just to kind of put all of that together, that's how all of those things are connected. Utilizing PRP to help rebuild the tissue, restoring circulation with the shockwave, supporting that desire, and further supporting your health with things like peptides, hormones, and supplements, and then supporting longevity at the cellular level too. I know this was a lot of information. What I usually recommend is just come in, chat with one of us. That's the best way to go about it because we'll really be able to hone in on, your medical history, your lifestyle, everything that's going to play into your sexual wellness overall and just your overall health as well. And so come on in, meet with one of us. That's where we can chat through everything, figure out the best bundles for you. And don't miss out on the February promos. All right, thanks for being in here and chatting.